So we're going to begin to look at the cranial nerves for this lecture, and in this class, Rate 301, we're just going to do a general overview so that you become familiar with the nerves and what their function is, and their general location within the brain and how they exit off the brainstem. When you get into Rate 401, the advanced sectional anatomy class, you'll go into much more detail in how the nerves course through the cranium and where they actually travel. But for now, I just want you to get a feel for them. So we have the list here, and as a general rule, the name of the nerve really does match its function. So olfactory for smell, optic for vision. The only one that never has made sense to me is the abducens nerve, the sixth nerve. It actually controls the muscles of the lateral motion of the eye. So there's no definition for that, and just have to remember it and memorize it. And then there's a couple of mnemonics down here at the bottom. The one that I remember from school is as the bottom one, or something similar to this bottom one. But I like the one, the top version in bold here, because I think it matches the nerves the way that I remember them, with the vestibulocochlear instead of auditory, and the accessory nerve instead of sensory, was the way I think I memorized them in school. And so this mnemonic matches much better than the second one. But whichever one works for you, you may find some others online, and that's great. If you find something that really works a lot better than one of these two, let me know. This inferior view from e-anatomy is as if somebody has their head tilted back and you're looking at the inferior side of the brain with the brain stem here attached at the bottom. And on the superior side, you have the most superior nerve is the olfactory nerve. So these are the olfactory nerves in the bulb going out toward the anterior portion of the brain to feed the nose and the sinuses. And then inferior to that is the optic nerve. Remember, the optic nerves are anterior to the optic chiasm. So here you have the right optic nerve and the left optic nerve, the optic chiasm, and then the right optic tract and the left optic tract. So the nerves are anterior to the chiasm and the tracts are posterior to the chiasm. And here's the infundibulum right here. And then you have the third and fourth cranial nerves. The third one being the oculomotor nerve, which helps to feed the eye muscles. And the fourth being the trochlear nerve, which also feeds the eye muscles. And we'll list them out a little bit later to show you exactly what each one what the function is for. Each one covers a specific muscle in the eye group. And then the sixth is also, the abducens is also an eye muscle motor control there. So 3, 4, and 6 course through the cavernous sinus, as does the first two branches, or as do the first two branches of the trigeminal nerve, the ophthalmic and the maxillary. The mandibular takes a different path out to feed the face. So the ophthalmic nerve covers some of the sensory information around the forehead and the tops of the eyes. The maxillary actually feeds a little bit more of the cheek and the upper lip, and then the mandibular is more the lower portion of the jaw down. And as you'll notice, 3, 4, and 6 sit on the superior, 3 and 4 are on the superior side of the pons, and 6 is on the inferior side of the pons, just at the pontomedullary junction, the junction of the pons and medulla. And the third nerve comes off anteriorly, whereas the fourth nerve comes off a little bit more posteriorly before it travels anteriorly. And then we go down after the sixth nerve. We have nerves 7 through 9 that are just at the superior side of the medulla. And then 10, 11, and 12 are a little bit more midway on the aspect of the medulla, but they're all on the lateral side except for this number 6, the abducens nerve. And the other place that's has a good visual of this is in Wikipedia. If you take a look at the cranial nerves, I think the one that I was researching at the time was the trigeminal nerve when I was looking for good images, and they have a nice colored version of this, almost this exact same view as E anatomy, but the nerves are all colored as they come off there, and it does make it a little bit more clear, so you may want to look at that image as well. So if we start by looking at this image on the right from Netter's, we can take a look at each nerve and this little images that they have to show you the function of each nerve, and it can help to solidify that in your memory as you're studying for the exams. So starting with the first cranial nerve, the olfactory nerve, which goes out to feed the sinuses and the nose, and it is the most superior nerve. It travels anteriorly out toward the nose, and this is the left olfactory nerve and the right olfactory nerve, and they sit just on the inferior border of the frontal lobes. So these are the frontal lobes here, and this is the inferior border of that. And then just inferior to the olfactory nerves are the optic nerves. And you'll remember the optic nerves are actually not midline. You can see the optic chiasm is midline and the pituitary gland is midline, but then the optic nerves travel laterally as they travel anteriorly from there. So on this midline sagittal here on the left, you've got the optic chiasm just anterior to the infundibulum and just superior to the pituitary gland. And this is a midline view so that you can't see the optic nerves. And the optic nerves are going to travel just a little bit not anterior as they travel laterally. They travel anterior and lateral at the same time. And if you are able to get a good scout image, you can do a very nice axial view that will lay out that nerve from the globe all the way back to the chiasm. And you can get a very nice axial view that shows the whole nerve in one plane. The other great view for visualizing the optic nerve is the coronal view, because you can do axial slices, coronal slices, but it's sliced on end. The nerve is sliced on end, so you get just a slice each time. And you can see the optic nerve and the meninges. The optic nerve is the only cranial nerve that is surrounded by meninges. So in a little bit later in this lecture, we're going to see a coronal view of the optic nerve. It's going to be a T2 weighted, so you can see bright CSF and bright CSF around the meninges, and then a fat saturated so that you saturate out the fat around the orbit of the eye, and then that way the nerve and the meninges around the nerve really stand out. So it's a great way to take a look at the optic nerve and any issues that might be happening there. From there we have the cranial nerves 3, 4, and 5. All three of those help feed the muscles of the eyes. We'll lay those out a little bit more detailed when we're taking a look at the orbit later on and show which nerves help which muscles function in the eye. It's not something you're going to need to know for the test, but it's just good information to be familiar with. And then we have the trigeminal nerve to feed the muscles of the face, and also our sensory nerves for the face. We went over these a little bit earlier. The ophthalmic portion, the maxillary, and the mandibular portion, all right here with this trigeminal nerve. The 7th and 8th nerve come off the medulla just inferior to the pontomedullary junction, and the 7th nerve helps to feed the muscles of the face and the taste buds, the lacrimal glands. And then the 8th nerve is a vestibulocochlear nerve, so it feeds the cochlea and the vestibule of the inner ear. And we'll go over that in a lot more detail when we study the inner ear, the IAC, in a later lecture. And the 9th nerve is the glossopharyngeal nerve, so it takes care of the posterior portion of the oropharynx, the taste in the back of the tongue, and the sensory, tonsils, pharynx, middle ear. And the 10th nerve is a vagus nerve, takes care of the heart and lungs. We took a look at that nerve a little bit when we were studying the abdomen and the chest. So that nerve travels down into the body rather than staying up in the head and the neck area. And the 11th and 12th nerves also are covering some of the muscles in the neck and the tongue. The 11th nerve is the accessory nerve, also sometimes known as a sensory nerve, so accessory or sensory nerve, and takes care of the sternocleidomastoid and trapezius muscle. And the 12th is a hypoglossal, so that's underneath the tongue, the muscles underneath the tongue. And then just as a reminder, remember that the 3rd, 4th, 6th, and 2 branches of the 5th nerve travel through the cavernous sinus. So we've got the image of the cavernous sinus here in the lower left. It is a coronal image, so we've got the pituitary here and the pituitary stalk, the optic chiasm, and then we've got the 3rd nerve, the 4th nerve, the 6th nerve, and then the first 2 branches of the 5th nerve here traveling through the cavernous sinus. So those are the ones that can have some issues when you've got any sort of tumors in the pituitary gland or maybe in the sinuses. They can be affected by a large tumor in that area. Another couple of interesting things to note on this page, especially with the 7th and 8th nerves as they both course through the internal auditory canal. When you're looking at them in a coronal view, you can see that the 7th nerve is superior to the 8th nerve, and you can see that a little bit here, but sometimes it gets confusing on the images. Just remember that 7 is up, 7 up, and the 8th nerve is just inferior to that, so 7 and 8. These actually come off in order, off of the medullary or medulla area in order, so it's easy to remember, but when you're looking at the images sometimes you forget, and so 7 up is an easy way to remember that. And then also take a look at this vagus nerve. Take a look at all of the areas that it feeds, and this vagus nerve actually goes down and does a loop around the aortic arch before it comes back up to feed other areas. So it feeds the larynx and the ear and the intestine somewhat. So any one of those junctions can be an area where the vagus nerve is being maybe compressed or blocked for some reason, and so it may be really hard, it may be a mystery to try to find out exactly why it is being compressed or what's affecting the vagus nerve, just because it does cover so many areas. So I just want to take a look at a couple of images here, and then we'll go over a few more images before we do the image review at the end of the week. But one image here of this fat saturated T2 weighted image, axial image. This is going to look a little strange to you because we are trying to focus in here on the brainstem, and what has happened is on the MRI, when you cut the image too small, you have some of the rest of the brain or the rest of the image wrap into itself. So here you're seeing the nose from the front of the face, and here you're seeing the back of the head in where the nose should be. So they're kind of overlapping images, and we're just trying to focus in on this high resolution area here of the brainstem. So you're able to see the midpoint of the pons here, right in the middle of the pons, inferior to superior. The basilar artery is anterior to the pons, and here you're seeing the left trigeminal nerve coming off the pons, and it's going anteriorly. Remember, the trigeminal is that really large nerve, so it makes it easier to see on these images. And then over here we see the right trigeminal nerve. And then on this coronal image, I remember I told you in the beginning that we're going to take a look at a T2 weighted fat saturated image, coronal image of the optic nerve. So when you're seeing the optic nerves with the meninges around it, again, the optic nerves are the only ones that are surrounded by meninges, and you're able to see that bright CSF really clearly because the fat that surrounds it is saturated. They saturate out the signal from the fat, and you're able to see that meninges really well. You can also see that this person has some stuff going on in their sinuses, and that's why that fluid is bright white. And then we'll do a little bit of image review as well. I want to take a look at a few images on e-anatomy, and this is a 3D T1 weighted brain. We're looking at an axial image. This is the anterior side of the patient, posterior, left and right. And we are looking at a T1 weighted image. We know that because the fluid in the globe of the eye is dark, and the fluid in the aqueduct of Sylvius is dark, so that's fluid is dark on a T1 weighted image. We also have a little bit of fluid on the very top point of this cursor that I have is a little bit of fluid around the meninges. Remember that there is CSF fluid around the meninges, and that meninges surrounds this optic nerve. So you've got a little bit of dark fluid around there. The optic nerves travel posteriorly. At the same time they're traveling posteriorly, they travel superiorly, and we're going to see that in just a moment. I'm going to bring back up the anatomical parts just for a moment so that you can see. Let's see, let's deselect all and select just the cranial nerves here. There we go. So you can see the optic nerve here, and you can see the third nerve coming off the anterior side of the pons. And if I just move, I think, one slice inferiorly, then you see the fourth nerve coming off the posterior. And it's really hard to see. I'm not expecting you to know that for the exam. I just want you to know generally where they are in relation to the cerebral peduncles and the pons. So I'm going to move back superiorly now so we can follow the track of the optic nerve, and I'm going to take off those anatomical parts now so they don't get in the way of the cursor. So as we travel superiorly, then we see that we get into that, just one too far, into the optic chiasm here, where the optic nerves come back from the globe of the eye, and then they become the optic tracts as they go most posterior toward the occipital lobe. So now you can see the optic tracts that they travel posteriorly. And they go around the cerebral peduncles towards the back of the brain. So now I'm going to move more inferiorly again. We can work through that. There's the optic tracts going toward the optic chiasm, and then from there anteriorly you're going to see the optic nerves. And then as we travel more inferiorly, there's that third cranial nerve again. We have the basilar artery here. You're catching that bright. It normally would not be bright, but you're probably catching some phase, rephasing of the protons as they travel through the vessel at that point. And as we travel more inferiorly, I'm going to show you the trigeminal nerve. Oh, I'm going the wrong way again. I apologize. There we go. The trigeminal nerve is a very large nerve, and it comes off the midpoint of the pons and travels anteriorly. It's the largest nerve. Some people at first get this confused with the 7th and 8th nerves, but you know that we're not quite near where the external ear, the external meatus is yet. So we need to go a little bit more inferiorly before we see that. You see the 4th ventricle here very nicely. So that's the end of that trigeminal nerve. And now here we have the 7th and 8th nerve. So you can see the 7th nerve is a little bit more anterior, and the 8th nerve is most posterior. The 7th nerve also goes up. So when we're looking at a coronal picture, you're going to see the 7th nerve superior to that 8th nerve. So you can remember that by 7 up. And on an axial image, when you think of up as being the anterior portion, you can think of 7 up in that plane as well. So 7th and 8th nerves on this side, and then on this side you can see 7th and 8th as well. So now I'm going to go into the coronal view and just show you very quickly the 7th and 8th nerves. I want to take a look a little bit too. After we go past the globe of the eye, then you can see the optic nerve as it travels most posteriorly. And we get into something called chemical shift here. So where the water and the fat meet, there's a little bit of chem shift, and that makes it a little bit harder to distinguish everything very clearly here in the orbit. You can see the optic nerves as they travel posteriorly, also travel a bit superiorly, and now we're in that area of the optic chiasm and the sella, the pituitary gland. We've got the cavernous sinus on either side, and that's where that 3rd, 4th, the 2 branches of the 5th and the 6th nerve travel through. And there's the infundibulum right there. And then as we go more posteriorly than that, we're going to be able to see the 7th and 8th nerves. They are not as easy to see on this MRI scan. We didn't get a very clear picture just because of the angle of the patient, but here you can see the 7th nerve goes more superiorly, and the 8th nerve is more inferior. Maybe on the other side we catch it a little bit. No, not too well on that other side. That just gives you a little bit better feeling for the cranial nerves, especially the ones that I want you to be aware of, the 7th and 8th. The 3rd, 4th, number 2, the optic nerve is really important, and the 5th, the trigeminal nerve. Those are the ones that you're probably going to be able to distinguish the best on MRI. And then let's take a look at the T2 weighted image of the brain as well. Because these are thicker slices, you're not going to see it as well, but what you will see when we go inferiorly here, they have this one backwards. Okay, so as we go inferiorly, yep, you can see that the sella and the pituitary gland, and then you can see the cavernous sinus on either side. We're just starting to get into the 7th and 8th nerves, and because you have a little bit of fluid there in the inner ear, you can see those a lot more clearly than you can on the T1 weighted images. The T1 is always good for pathology, and T2, you can see the fluid real well, so you have to do both sets of images most of the time. But here you can see the 7th and 8th nerves. Again, I'm going to take off the anatomical parts so that you can see them. There you go. And also remember that the 7th nerve comes off a little bit more medial and more anterior to that 8th nerve. So 7th nerve is anterior and superior and also medial. And the 8th nerve is posterior, inferior, and a little bit more lateral as it takes off from the pons. And one last thing I wanted to show you in netters, especially as you start to study the nerves a little bit more in depth, if you go into rate 401, these are great images within netters that allow you to see the nuclei of each cranial nerve so that you can see where in the pons and medulla the nerve originates. So here you have the cerebral peduncles and the quadrigeminal plate, the aqueduct of Sylvius as it comes down in the fourth ventricle, and the cerebellum, the pons, and the medulla. And you can see each of the cranial nerves and where the nucleus originates. So you have the 3rd nerve here coming anteriorly off the, just where the pons meets up with the cerebral peduncles here. So that's the 3rd nerve, and the 4th nerve you can see originates on the posterior side and then wraps around as it goes towards the cavernous sinus. And the 5th nerve, you can see how thick that trigeminal nerve is as it comes off the midpoint of the pons. And then the rest of the nerves here are all inferior to that. So this is another great image, and then there's one more. I'm going to just slide down here a little bit and see if I can bring it up. Oh, there we go. And then this is a view from the posterior side, and you can see that they've kind of opened up the brainstem so that you can see both sides of the brainstem and the nuclei and where they originate. And it just gives you one more view to take a look and get a little more familiar with how those nerves exit the brainstem and feed the rest of the brain and body. And that will be our lecture on the cranial nerves.